Hi there, my name is Valerie Cavill. I'm one of the midwives here at Albany OBGYN, and welcome to the second trimester of your pregnancy. The second trimester includes weeks 13 through 28 gestation, often referred to as the honeymoon phase. This is because you're officially through the first trimester, and the placenta is now developed and taking over hormone production to help support your growing baby. Let's first review what your appointments will be like. This trimester, most women will remain at 4-week intervals for appointments unless we have discussed otherwise. At your appointments, we will check the following things: your blood pressure, your urine for protein and glucose, your weight. We will listen to your baby's heartbeat. And after 20 weeks, we will begin to measure the growth of your baby with a tape measure, as well as check the baby's position and size with our hands. Your appointment will also include some time for you to ask questions and address any concerns that you may be having. During this trimester, there is some testing that is recommended. Most women at this point have completed the first part of genetic screening for chromosomal abnormalities if you have chosen to do so. This trimester, you will complete part 2 of this screening. These tests are either an MSAFP or a sequential 2, depending on the type of screening you have chosen. These are both simple blood tests that we provide a prescription for, and you will have drawn at a local laboratory. You will also have the second of 3 allotted ultrasounds for your pregnancy. This one is called an anatomy scan. We will check to see that all of the fetal organs are developing as they should, and measure the size of your baby. This is also your opportunity to find out the sex of your baby if you have chosen to do so, or you can choose to leave it a surprise for the birth. The decision is completely up to you and your partner. The third item that is tested in the second trimester is a complete blood count to help us see if you may be anemic, as this is a common occurrence for pregnant mamas. If your blood type happens to be negative, we will also order an antibody screen to determine appropriate timing for a RhoGAM injection. This medication helps ensure that your body does not create antibodies against your baby. And then there's the glucola testing or gestational diabetes screening. To prepare for this, we recommend that you schedule an early morning appointment, eat a light protein-based breakfast such as an egg, and have a little water. It is also best the night before not to indulge in carb-loaded or high-sugary meals or snacks. Now let's go over the changes you may be experiencing in either common discomforts of pregnancy or physical changes that may be taking place. Not every woman will experience all of these, but it's best to know what to expect. You could have skin changes. This can be anything from stretch marks to the pregnancy glow, leg cramps, hemorrhoids, heartburn or acid reflux, constipation, headaches, hair growth, frequent urination, dizziness, occasional heart palpitations, vaginal discharge called leukorrhea, congestion, minor nosebleeds, breast enlargement, and you may start to look and feel pregnant as your uterus and baby are growing rapidly. You also may experience bleeding gums, backaches, achiness, or discomfort in the lower abdomen, also known as round ligament pain. You may even start to feel occasional Braxton Hicks contractions towards the latter part of this trimester. This should feel like a tightening of your belly, not period cramps, just to be clear. And the big one, you should start to feel your baby moving inside. The timing is very different for all women, but it will occur between 20 and 24 weeks, especially if this is your first baby. Some hints to help with some of these discomfort: drink lots of water. The recommendation is up to 1 gallon a day. Remain active. Exercise is okay and recommended, although we advise you not to start a new rigorous program. Moving your body is important and it's encouraged. Most exercise programs have modifications that are safe for the pregnant mama, so making time to ask questions if you're working out. Also, taking time for you, whether you choose yoga, massage, meditation, simply getting your nails done. Self-care is so super important. If you're experiencing any of the discussed symptoms or have any cause for concern, such as regular contractions, bleeding, or period-like cramps, leaking of fluid, please contact our office and feel free to discuss any of this with your midwives. We can help you understand what is happening and more often than not offer relief measures and support to help you cope. Finally, towards the mid to the end of the second trimester, you should begin to think about your birth and what you imagine this to be. Some choices to consider, some childbirth education classes, online classes, and some are in person. Options might be available depending on where you look. Do you need or want a doula? Both of these options give you the education and preparation to help you rock your birth. And of course, that is what we are here for as well. Some other things to consider: circumcision, education on breastfeeding, infant or child CPR, infant basic classes, thinking about choosing a pediatric provider. All of these things can be discussed in further detail at your upcoming appointments. We are here for you and are happy to answer any questions you may have. We are here to help and support and guide you through your entire pregnancy. Congratulations again, and welcome to the second trimester. I look forward to meeting you in person.